Why this story matters in a world often dominated by negative headlines, stories like this remind us that meaningful progress is happening every day.
Quick summary: this story highlights recent developments related to births, showing how constructive action can lead to meaningful results.
1 in 10 babies in the US in the 1840s and infants were born preterm in 2020, meaning before 13 weeks of pregnancy.
More than 15 were very preterm, meaning they were born before 32 weeks.
A full-term pregnancy lasts 40 weeks. Florida's rate is slightly higher at about 1 in 9 babies born preterm. In an average week, 456 of the 4,750 babies born in the state will be preterm, and 78 of those will be very preterm. According to the March of Dimes, preterm birth and low birth weight-related health complications cause 37.5% of infant deaths nationwide. This makes preterm birth the second leading cause of infant deaths, after birth defects. Preterm babies who survive infancy are susceptible to health complications later in life, including cerebral palsy and learning disabilities.
Would you like to read more good news about births? Preterm states, reduced Florida a model.
Preterm and low birth weight babies, those weighing less than 5.5 pounds 2,500 grams, are far more likely to go to the neonatal intensive care unit, or NICU. Very preterm infants tend to have the longest NICU stays, averaging around 43 days.
Beyond the emotional toll this takes on a family, preterm births and their resulting health complications carry substantial financial costs.
The average NICU admission in 2021 cost around $6,000. And economists estimated the lifetime societal cost of all preterm babies born in 2016 from birth to subsequent disability care at $25.2 billion. We are a public policy Ph.D. student and public policy researcher focusing on health policy and population health outcomes.
Recently, we were sifting through the data on preterm and low birth weight rates in the US in search of places that are doing better than average at preventing preterm births.
And that is what we found in the Central Hillsborough Healthy Start program, which serves a cluster of Tampa ZIP codes with roughly 113,000 residents. In 2008, this program published records showing 30 low preterm and low birth weight rates among families at highest risks. Peer-reviewed evaluations linked participation in the program to substantial reductions in preterm and low birth weight outcomes. These remarkable improvements remain consistent through 2020. When we looked at what this program is doing, we found a set of practices that can serve as a model for other counties in Florida and around the US to lower preterm birth rates, saving money and, more importantly, lives. The program does early screening for risk factors of preterm birth using Florida's Healthy Start prenatal risk screen at the pregnant person's first prenatal visit.
This screening has been proven to correctly flag a good share of high-risk pregnancies, while avoiding many false alarms, helping scarce services reach families who need them most.
This is key because the risk of preterm birth isn't spread out evenly across all pregnancies. The neighborhoods that Central Hillsborough Healthy Start serves include many young, Black, unmarried, low-income families that are eligible for Medicaid.
All of these factors place them at high risk for preterm birth.
Early screening allows the Healthy Start program to identify mothers at highest risk and tailor its resources to assist them. Measuring against the rest of the state, the Florida Healthy Start prenatal risk screen is available throughout the state. Florida created Healthy Start in 1972 precisely to reduce infant deaths and low birth weight through universal prenatal and infant risk screening, community coalitions, and coordinated services. While Florida's preterm birth rate in 2020, the most recent year for which there is data, was 10.7, Hillsborough County tracked slightly below the U.S. average of 10.4, about 10.2 of the county's 16,900 births. That difference may seem small, but it represents 85 fewer preterm babies in Hillsborough County, and at the average rate of 70,000 per NICU admission, that's about $6 million in hospital spending avoided in a single year. In addition, statewide, 14.8 of Black infants were born preterm in 2020, slightly higher than the 14.6 average across the U.S. In Hillsborough County in the same year, it was 13.9. Among pregnant women without a partner, participation reduced very preterm births by 52 and half the rate of very low birth weight babies, that is, babies weighing less than 3.3 pounds 1,500 grams. Obese mothers in the program had a 61 lower chance of extremely preterm birth, which means birth before 28 weeks of pregnancy, than comparable women elsewhere in Florida. Even exposure to air pollution, a known risk factor for preterm birth, was less harmful among women in the program.
So what has Central Hillsborough Healthy Start been doing differently?
The Central Hillsborough Healthy Start model, the model used by Central Hillsborough Healthy Start, is practical and straightforward. After early screening, nurses make home visits and help coordinate patient care for mothers in the program. Central Hillsborough Healthy Start also provides prenatal education, depression screening, and programs to help pregnant mothers improve their health and decrease harmful practices such as smoking or substance abuse.
These programs are critical because obesity, diabetes, hypertension, and smoking during pregnancy are significant risk factors for preterm births.
The program also helps to connect patients to resources they may need during and after pregnancy by making personal introductions to community partners, such as women and infant resource specialists in women, infants, and children, or WIC clinics.
Healthy Start workers also connect patients to interconception care for healthy birth spacing between pregnancies, which can help prevent future preterm births. Studies show that more than 30 of US mothers who give birth preterm conceive their baby less than 18 months after having their previous child.
The Healthy Start staff use Florida's coordinated intake and referral approach to track referrals and follow up across partners.
This is vital to helping the program staff see who has been contacted, which